Hello and welcome to today's video. Our topic today is about the artificial vision. What can people see with the bionic eye? Now, what is the bionic eye? The bionic eye is a service provided for patients with severe forms of vision loss due to a disease called retinitis pigmentosa. This disease is inherited and affects 1 in 4,000 people, affecting 1.5 million people worldwide. It is the leading cause of an inherited blindness. There is no cure whatsoever. Some patients, however, may lose their complete eyesight due to retinitis pigmentosa. Now, people with retinitis pigmentosa fall within 3 different categories, as you can see here. The first one is dominantly inherited mutations. The second one is recessive mutations, which may lose sight at an early age. In this case, it is the group that will benefit the most from the bionic eye service. The third category is a dominantly inherited disease. Patients often retain their eyesight in the future. In retinitis pigmentosa, patients undergo a degeneration in the photoreceptor layer of the retina, which is the outermost layer of the retina adjacent to the retina pigment epithelium. Also, it is the portion of the retina that undergoes the most rapid degeneration. Now, how does the bionic eye work? Let's see. It provides sensory substitution or a replacement for those lost photoreceptors. In other words, an input to the retina that allows sending visual information through ganglion cells down to the optic nerve, to the brain, in order to form a visual percept of the patient's picture. The bionic eye has an electrode array that flats and conforms to the inner aspect of the retina or the ganglion cell layer. The bionic eye can stimulate those ganglion cells to produce visual percepts that are called electrophosphines. Okay, now the visual world is interpreted with a camera. As you can see here, this is the glasses, this is the camera, and this is how the patient can visualize what's in front of them. In this case, with a video processing unit worn on the patient's belt, around the chest, or maybe shoulder. An electrical signal is sent wirelessly to a pair of glasses to an implanted chip, and mostly this chip is found next to your ears. So as you can see here, this is the chip and it sends wireless electrodes to the brain, so you can picture the image in front of you. These signals are then interpreted and sent as series of electrical impulses to the electrode. Then, it stimulates the ganglion cells in a patterned manner. Therefore, the device is prepared to give a video image with approximately 60 points of stimulation that forms points of light that are recognized by the patient. So, let's go back to the images. Now, this is the glasses that your patient wears, this is the camera, this is the wireless transmitter. What happens here is that, as we said, the cable here sends wireless information to the brain, which allows the person to view what's in front of them in a video manner. And in this slide, we explained the points of stimulation produced by the bionic eye, which are approximately 60. Now, during the surgery, your surgeon will cover your eye implant with eye tissue. To this tissue, they'll connect your existing eye muscle to allow for natural eye movement. Your bionic eye should move in sync with your healthy eye. But be aware that your prosthetic eye, which is also known as the bionic eye, will not move as fully as your natural eye, but it'll still move somehow. Okay, now, if we want to discuss the cost of the bionic eye, the surgery itself is approximately equal to 150,000 Australian dollars. Wow, that's a lot of money. Additional fees include the implantation surgery and training to use the device. Now, if you want to think who's eligible for this surgery, patients that have age 25 or older are eligible, or people that have bare light or no light perception in both eyes. Bare light perception is the ability to perceive light, but not to the direction from which the light is coming. If the person has no residual light perception, then evidence of intact inner layer of retina function must be confirmed. a previous history of useful form vision. For example, as I mentioned before, that the retinitis pigmentosa itself is a disease that is inherited from your ancestors or family members. In Australia, even though that there's no cure for retinitis pigmentosa whatsoever, Bionic Vision Technologies announced today that researchers from the Centre for Eye Research Australia, also known as the CERA, have successfully restored a sense of vision in 4 blind people using the bionic eye, as part of the clinical trial that was held in University of Melbourne, as you can see here. Now, this has allowed patients to go outside and, importantly, in their homes without the need of supervision. Melbourne researchers have been working hard to create the portable and permanent device to ensure that the patients with the implants can have a better, improved quality of life. Thank you.